you don't look like somebody who was born prematurely. And
Well, I don't look premature, so you know what that means? We always say at Doris Mollel Foundation, premature baby can survive, but only given the right care at the right time. I am a 900 premature baby. I always call myself a firstborn twin premature baby, and I'm actually a 27-weeker. I was born in 1990, of course in a national hospital, but background, I'm coming from an ethnic society. I'm a Maasai by tribe, where prematurity is highly considered as a curse. And sharing these stories with you all inspires me to determine what it means to care for a premature baby, and at some point what a premature baby means when he or she is well cared. That means they can thrive and go and be anybody they wish to be.
at what point did you decide that it's time to act?
Well, that was in 2015. In 2015, yes, when I was crowned as the second runner-up of Miss Tanzania. Usually beauty queens are supposed to give back to the community. So I spoke to my mom about it, and she was like, don't go for any other cause than premature babies. I'm like, really? What's a premature baby? So actually, she started explaining to me that you were born not able to breathe on your own. You were born not able to suck your mom's milk. You were born not able to fight your cold. So you stayed in warmth for 3 months. And actually, you were a twin. So your twin was 1.2. That's my twin brother. And you were 900 grams. So I had to carry all of you in my chest and stay with you for all those 3 months. And luckily, my mom was a nurse by then at the National Hospital. So I'm proud of everybody who was there to take care of us. We have all managed to survive. But I understand that prematurity is one of those challenges that babies do get, and they're likely to face a lifetime disability. So if you take care of the prematurity cause itself, you can actually reduce the number of disabled kids we have in our continent.
So what does your organization do?
So Doris Mollel Foundation was founded in 2015 with the main cause of reducing neonatal mortality rate that's highly contributed by 40% with prematurity. So my foundation raises awareness, donates equipment in government hospitals. So far, I've managed to donate in 60 hospitals, so I'm very happy about it. And also, we do advocacy on policy change and creating family-friendly policies and at all, changing laws, working with decision makers and policy makers. But now the foundation has added a component of research. So we have actually started to invest on research on prematurity as a whole.
So I know you said your mom inspired you to get involved in this, but personally, what did you see that encourages you on a daily basis to push on this activism?
Well, actually, what makes me work tirelessly nights is because of understanding that the moment I stop working, we have a good number of premature babies dying. We have a good number of premature babies who are actually getting to be disabled just because we don't have knowledge, just because we don't have the facilities, and just because the policies are not in the right place. And people are ignorant about the cause. So all that makes me not sleep, and understanding that there are hardest to reach communities that hardly do not know anything about prematurity, and I have to call up all those actions, put the space, involve more donors, involve more people, involve more faces, involve more influencers. So I'm happy that the foundation has brought about celebrities in Tanzania and across East Africa to raise awareness about this cause, and it's really my passion. That's what I would tell you.
So I know as part of your advocacy, you try to influence policy. Have you influenced any policy, and how has it helped in your cause?
Well, such a lovely question. Wow, three things. So I'm proud of pushing the government to budget for premature babies. So last year when Honorable Umi Ali Mwalimu, our Minister for Health, when her first time she mentioned that the government has budgeted 23.36 billion to build 100 NICUs, to train the healthcare workers, and to bring a space that is great for families of premature babies. So that's something that we were working for 6 years, and it's a milestone. Another good milestone that I would really, really like to share with you is that our foundation has managed to involve in the private insurers to incorporate the premature baby medical costs into the health insurance of a mother. So that's a good milestone. And now the best milestone that it was also part of the Born Too Soon Action Report recommendation of 2012 was to reduce the knowledge gap. So our foundation is working very closely with the Ministry of Education in Tanzania to incorporate the prematurity knowledge into science and biology subjects. So our president, Dr. Samia Suluhu Hassan, has allowed in a review of curriculum. So we took that opportunity to incorporate the knowledge into science and biology subjects, and we're very, very happy with those milestones. The best of all, we are now amending the parental leave law to favor parents with premature babies. We're at a very good stage in Tanzania, and actually we've decided to take the petition to East African. So the 7 countries of East Africa are now discussing on amending the parental leave law with the efforts of the Doris Mollel Foundation, who got inspired from the Born Too Soon report. So I'm very, very happy about it, and it's something that I'm very proud to work in.
Yeah, so I was going to ask about your connection with the Born Too Soon campaign, which has just released a report. How does it connect with what you do in Tanzania?
Well, I always tell Anna and Prof. Joylon that Born Too Soon report was like our Bible, like a guidance to what we do. So it's from the 2012 report when we created strategically our programs, we directed our activities. So from the recommendations, that's where we created our programs and advocacy interventions to support premature babies. So we're very grateful of the 2012, and a decade later on, see all these beautiful changes, see what the government has done. And what actually I'm really proud of is that our highest level leaders in the government, I'm talking about our president, Dr. Samia Suluhu Hassan, who donated 70 million shillings to our foundation last year in the commemorations of the World Prematurity Day. So that's a very high-end advanced level where the president is highly getting involved in it. And also our vice president, Dr. Philip Mpango, also donated himself equipment to support premature babies. That was last year. So for me as an advocate, I feel so proud that we have highest level power in our country supporting premature babies. They also even got a chance to allow me in and thank me for all the interventions and all the hard work that we've been doing to support these premature babies. So I'm very happy that the highest level of our government is in support of this cause, from the president to the vice president, and all members of the ministerial cabinet are all in support of this cause. So I'm very proud of that.
So on a final note, in some communities that I know across Africa, parents of prematurely born babies don't only have to deal with the loss,
yes,
but also, their relationship with people in their communities.
Very true.
In terms of how they perceive them. What is your experience, your family's experience? Generally, the Tanzanian community, what is it like?
Well, I would say Tanzanian community is a community where still not yet enough awareness about premature babies. And the most hardest to reach areas, I'm talking about the ethnic societies, I'm talking about people who are living in the islands community, are still so lagged behind with information of what premature baby is and how do we go about to prevent it. Because the biggest key thing is, are we preventing? If there's an increment of premature babies, which is, yes, we have an increment of premature babies every year. So prevention directives are very key. And we have to work together with everyone to be involved in these actions so that we can help to prevent prematurity. But on top of all, still we are lagged behind with lack of enough awareness to help the communities understand better what premature babies are. And it's only a matter of a little time the baby will come back to any other person. I mean, they will grow up and thrive like any other baby. So the biggest challenge we are still lacking enough information about it. And we still need to drive more advocacy and awareness about it. So that's what I'm really keen. And if you're asking me to give one word of my best wish, it will be my recommendation to the United Nations, to the World Health Assembly, to incorporate the World Prematurity Day in their calendars. When we have the World Prematurity Day in the UN calendar, we have this day commemorated in all the countries where UN is, where WHO is, where UNICEF is. And you know what that means? Everywhere in every community, the awareness will drive significantly, and we'll have numbers, even if it's not going up, but at least we'll have prevention of disability that can come out of prematurity.
I know I said that was my last question, but there is a question that I can't help asking before going. You don't look like somebody who was born prematurely. And I'm sure people who are going to be watching are going to be, asking themselves this question. What is the secret behind it? And how do you think your story can inspire other people?
Well, I don't look premature, so you know what that means? We always say at Doris Mollel Foundation, premature baby can survive, but only given the right care at the right time. So I am that product of the right care at the right time. So we all need and dream and wish all the premature babies born in our African continent can have that, so they can grow and thrive and become like any other celebrity, any other good person. We have all these beautiful names, Isaac Newton, Stevie Wonder, all excellencies who are doing so well, born prematurity. Those are the faces that people should be looking at too. And also we have newly advocates like Doris and our presidents and vice presidents who are talking about it, who have seen it, who know it's possible. So I'm calling as an action to every mom to believe that a premature baby can grow and thrive, but only given the right care. So we all need to thrive to get the right information to our community, especially the hardest to reach communities like where Doris is from, the Maasai community. Yeah.
Thank you.
Thank you very much.